and you welcome to my channel. In today's section, I'm going to discuss about the neuropathic pain. In previous video, I told you about the pathophysiology of the pain in general, but in today's section, we are more concentrating on the neuropathic pain. So, the neuropathic pain, in today's video, I'm going to discuss about the neuropathic pain pathophysiology and the reason behind neuropathic pain and what's the diagnosis for this type of pain and the new treatment for neuropathic pain. First, let's discuss about the neuropathic pain definition. Neuropathic pain is a complex and chronic pain caused by the damage or injury to the nervous system. This is very important. The injury to the nervous system or damaging of the nervous system, which is differentiate from the other type of the pain, such as the nociceptive pain that is caused by the tissue damage or inflammation. So, the neuropathic pain is caused by the damage or injury to the nervous system. But the other type of pain, like nociceptive pain, is caused by the tissue damage or inflammation. So, let's get into the second part. What's the reason behind neuropathic pain? The major reason behind the neuropathic pain is that, first of all, the nerve injury or damage. Nerve injury or damage, which is the one of the important reasons behind neuropathic pain, can be caused by the traumatic injury or surgery or infection or any other diseases such as the diabetes or multiple sclerosis. So, second reason behind neuropathic pain is the abnormal signaling from damaged nerve. So, what is mean by this? The nerve may send pain signal to the brain for no reason or respond to stimuli that normally wouldn't cause the pain. So leading to misleading or sending the signal to the brain from the damaged nerve. So this patient is feeling pain. So the third reason behind neuropathic pain is the chemical imbalance. The chemical imbalance is another type of the another reason for neuropathic pain. Change in neurotransmitters or other chemical in the body can affect the nerve function and cause the pain. So, the another reason behind neuropathic pain is the inflammation. So, the inflammation, like chronic inflammation, can damage the nerve and cause them to send the pain signal. So, different type of inflammation, for rheumatism or any inflammation which is related to the immune system, leading to releasing some chemical compound at the same time or sending the signal to the brain and feeling the pain. So the last cause of the neuropathic pain is the genetic. Certain genetic mutations may increase the risk of developing the neuropathic pain. So, and another important thing I want to discuss today is the symptoms of neuropathic pain. The common symptoms of neuropathic pain is burning pain in affected area, feeling like a burning. Okay, may feel like a burning sensation or pins on needles. This is one of the main symptoms of neuropathic pain. The second symptoms of neuropathic pain is a sudden or sharp stabbing pain. Okay. In this symptoms, the patient may feel like electric shock or shooting pain. In this type of pain, which is annoying and very painful. And the third type of the symptoms of the neuropathic pain is a loss of sensation in affected area. May feel like prickling sensation or the loss of sensation in affected area, which is in this one is mostly happening in the diabetic patient. Okay, and another type of symptoms of neuropathic pain is the increased sensitivity to touch or pressure. The patient may feel like intense discomfort or pain with the light touch or pressure. This is another symptoms of neuropathic pain. The another symptoms can caused by the neuropathic pain, which is weakness or paralysis in affected area. The weakness and paralysis in affected area and other symptoms of neuropathic pain may affect the movement. The patient cannot move. Imbalance. The patient cannot have balance anymore, and coordination. So this is the major 5 symptoms of neuropathic pain, which is differentiate from the other type of the pain. So, diagnosis and treatment of neuropathic pain. So, in diagnosis, we can diagnose the neuropathic pain. The first of all is a physical examination. The physical examination, which is one of the important type of examination, like tapping or pressing the painful area to see if there is a heightened sensitivity. So, the second type of diagnosis is a neurological exam, testing reflexes and muscle strength and the ability to feel different sensation, which is another type of diagnosis of neuropathic pain. The third type of diagnosis is the electromyography. By the name is indicate that the measuring the electrical activity in the muscle to determine the nerve damage. Okay. Another type of diagnosis test we can use is the nerve conduction studies, NCS. In this type, measuring how well nerve can send signals and identifies nerve damage. Okay, and the last part, which is the MRI or CT scan. CT scan, MRI, we know it is used for different cases and different neurological diseases like epilepsy, or in severe cases can use for the different type of the nervous system damage. So in MRI and CT scan can visualize the spinal cord and nerve roots and detect any abnormality. Okay, we are concentrating on the pain, from where is coming this pain. So in this case, the CT scan and MRI we are using for visualize the spinal cord and nerve root, and we are just concentrating any we are just detecting and seeing if there is any abnormality can observe in the spinal cord or nervous system. So the common treatment for neuropathic pain. The most common treatment for neuropathic pain including the medication or physiotherapy or alternative therapy. The first of all, medication. The common medication used for treatment of neuropathic pain include the anticonvulsant, and the second is antidepressant. The last one is opioid, the drug which is working on the opioid, like a morphine. And the anticonvulsant, some of the medication we can use for neuropathic pain, like gabapentin and pregabalin, we can use it. The second type of therapy is the physiotherapy. In physiotherapy is a physical therapy. The physical therapy can help to improve the mobility and reduce the pain by strengthening the muscles. Okay, it's very important. Strengthening the muscle and improving the posture and increasing the flexibility. So, by increasing flexibility, strengthen the muscle, leading to cure the neuropathic pain, improve the such type of pain. So the last part is the alternative therapy. Alternative therapy such as the acupuncture. This therapy also in some country or some area used, which is we are here now more concentrating on the recommending as a pharmacist. We are just concentrating on the anticonvulsant, antidepressant, and opioid, and physiotherapy also very important for curing such kind of disease. And lastly, I'm just going to discuss about that. There is the continuous research in neuropathic pain, because emphasizing the importance of advance in the treatment for this condition. The neuropathic pain remain a difficult and complex disease and still challenging, and because the research is continued to treat this type of pain and for developing effective treatment and improving the patient's quality of life. Thank you very much for listening. I hope this video very helpful for you.